So now we are making video on laparoscopic suturing practice. So first, what you do, you make this thread straight, right? By holding to the thread, make it straight, so that when you are suturing, it will not get entangled. Then, first thing is you should not go and hold the needle direct, because once you hold the needle, it becomes knife. So what you do, you hold the thread. When you lift the needle and then hold the needle. Understood? Then what you do is you align the needle. Suppose you are holding needle like this. Now this is not properly aligned. So what you do, you align it first. Hold the thread and you can rotate it like this. You can completely rotate it. So you can practice this rotating. So now why I am able to rotate the needle? Because I have not locked this needle holder. See, I am just holding it. If you lock it, then you will not be able to rotate it. So the important thing is you should not lock this needle holder. You should hold the needle only. Then once it is properly aligned with your right needle holder, go and hold the needle at anterior 2/3 and posterior 1/3, right? So this is how we are holding the needle. Then how to drive the needle? So with the help of a wrist movement, you are supposed to drive. You should not use any force, just with the help of wrist movement. So you go and like this, then release, again push it, and then go here, just with the help of wrist movement, drive the needle. After needle comes out, leave needle. Don't hold the needle and pull it, because if you hold the needle and pull it, again needle has become knife, and if you touch bowel or some other organ, it will injure those organs. So don't do this. You just leave the needle once it comes out and hold the thread and then pull it. Then one by one, you can pull it till the end. Okay, now we have sufficiently pulled the thread. Now next step is to make a C. So what we are going to do is we are making a C. So this is a C. This is upper arm of the C. This is curvature, and this is lower arm of the C. Then this lower arm, what you do is you make it parallel to the needle holder. So this is a needle holder, and you make this parallel to this needle holder. If this arm is like this, then there will be difficulty in suturing. So first thing is you hold it here, then make it parallel, and then with the help of left needle holder, just go below the thread. See how easily it is going and making the loop, right? So two loops are made. Then you go and hold the short thread and keep the needle holder there only. And now you are supposed to pull only thread with the help of right needle holder. See, if you do it like this, you will not waste the thread. Understood this? Yes. Now again, what you do, hold this thread and again come back and make a C. Now this time we will take only 1. So acrylic knot configuration is 2 1 1. Again, left needle holder is constant. With the help of my right needle holder, I am just pulling the thread. Done. One more. See. Okay, we have made a C, and then from below, rotating the needle holder, holding the thread, and only with the help of right needle holder I am pulling the thread. Any doubts on this now? No doubts? Complete clear? Oh, stop.